Welcome to the first Telfer Forum of 2021. Today's event is part of Telfer's commitment to bring together research and practice. Ultimately, we aim to empower healthcare leaders and managers to create a healthier Canada.
The theme of today's forum is Learning Health Systems, Facilitating Healthcare Innovation and Integration. Healthcare leaders and professionals have been working to make the healthcare system more agile and integrated. The COVID-19 pandemic has helped the healthcare workers to be exposed and accelerate the need for this transformation. So today we're going to discover how learning health systems can help healthcare researchers and practitioners facilitate integration, innovation, and knowledge uptake.
The initial vision for a learning health system is really a healthcare organization, whether it's a hospital, a primary care provider, a regional care center, that establishes the structures and a culture for rapidly and continuously learning from the huge volume of data that are now available, clinical data, operational data, scientific data, through EHRs, scientific databases, health information systems, basically use obviously all the advanced computing capabilities that are also available today to continuously learn to improve patient care, improve efficiency, as well as safety.
I think that the starting point is to realize that learning health system is not a product, it's not like EHR, but it is rather institutional way of leveraging data for continuous improvement.
The number one or major challenge in healthcare delivery is the inability of the system to connect, to collaborate, and to learn from individual episodes of care, and the inability to adapt to new processes and technology. And fundamentally, they documented that the inability of the system to learn and to do something with that learning was a gap. So in the cancer program in the Ottawa region, we have been implementing elements of a learning health system for many years. Essential to that has been our ability to create these iterative learning teams, which are primarily focused on social engagement, trust building, and specific projects for development. These teams are what we call our collaborative learning platform. It is a platform that we engage to produce change in the region. And this collaborative platform is so important in a learning health system if we're trying to do big projects, because it allows practitioners across silos and organizations to come together and transcend some of the barriers that are structurally preventing collaboration.
So the sea change process in which we have gotten together with all the major organizations. So we started out with 8, the current number of organizations is 11. So that includes folks like Hypertension Canada, Heart and Stroke Foundation, Canadian Cardiovascular Society, with all their favorite guidelines. We get everybody together, and so that they we all look together to say, what are the most important action items for every physician, for every provider, for every team in the country, so that we can actually maximize impact. So we reduce from a total over 1,000 recommendations in terms of what to do with cardiovascular risk management and treatment down to 75, and people loved it.
While the most we learn, and often we learn from failures, so we should allow and in a sense embrace failures and learn for them in order to improve how data can be used.